Now let's solve this ophthalmic sign 107 which I posted, and you can see it looks it gives a look of something inside the anterior chamber, and if you look closely here at 6 to 9 o'clock, there is a haptic of posterior chamber IOL that is touching the corneal endothelium, and that caused corneal decompensation and painful bullous keratopathy. Now the patient underwent uneventful cataract surgery at free surgical eye camp, and when I examined the patient, I thought maybe there was some complication, posterior capsular rupture, and the patient may have the ACIOL. But when I examined closely, and I found PCIOL, haptic touching the cornea and causing corneal decompensation, and the patient was in pain, photophobia, watering, pressure was also high. So I told him that we had to either remove the lens if there is no support, or if there is support, we can place the haptic behind the pupil. So when I dilated the patient and examined him, I got surprised that there was no PCR, posterior capsular rupture, and it was just in an extreme hurry this negligence occurred, that the surgeon, as camp surgeons have 2 or 3 minutes for a single cataract surgery, so he thought that he has implanted both the haptics in the bag or behind the iris, but one was left, and in a hurry he forget to place the inferior haptic, and that haptic then touched the corneal endothelium and caused all these symptoms. So first I gave this patient topical steroids, hypertonic drops, anti-glaucoma drops, atropine, cycloplegic, and then when the condition improved, the bullous keratopathy improved, the cornea improved, then I redialed, repositioned the inferior haptic in the bag, and there was full support. So just due to negligence, the surgeon forgot to place the inferior haptic behind the iris and caused this patient so much pain. So I thought I should post it, and definitely from this video it is very difficult to locate the haptic and where it is touching, but one can see that how much it has impacted the cornea, and all the things they are in the inferior half of the cornea where the haptic was touching. So I have repositioned. So take home message from this video is that whenever we are doing surgery, placing the IOL haptics in the bag, or at least if you are implanting a rigid one in the sulcus, these are very important steps of surgery, and if you forget to implant it, sometimes the haptic reaches the cornea, and if it touches the cornea, you can face this complication. So always give 5 to 10 extra seconds and make sure that when you have completed the surgery, everything is in place and you have removed all the gel and you have closed all the wounds. Thank you very much.